Hello, I'm John Clohessy, Chief of Adult Reconstructive Surgery at Washington University School of Medicine in the Department of Orthopedics. I'd first like to welcome you to our practice and thank you for selecting us for your total joint replacement care. We have an outstanding team that is going to help you with your care and your journey through this process. We are part of the Orthopedic Surgery Department, which is one of the premier departments in the country. Collectively, we are focused on outstanding clinical care and innovation in orthopedic treatments. In total joint replacement, we have an incredible history of leading the way in innovative care, including rapid recovery and outpatient total joint replacement, robotics and computer navigation procedures, and the use of various surgical approaches and implants. We currently have several surgeons and a large, diverse group of healthcare providers who manage our clinical practice. The entire team is committed to safety and excellence in patient care. Thank you again for letting us provide your total joint replacement care. We hope the following information is helpful in preparing you for your journey and that you enjoy an excellent outcome.
Thank you for joining us to learn more about joint replacement surgery with Washington University Orthopedics. Replacement surgery is also known as total knee or hip arthroplasty. This video series is intended to help you prepare for surgery and plan for your successful recovery. This is the first video of a three-part series. The goal of this video is to discuss the medical workup and necessary steps to complete before you have surgery. Other videos in this series cover the events that occur on the day of surgery and during your hospital stay and recovery after your surgery. Let's discuss what will happen before surgery to better prepare you for your journey into a life of greater mobility and independence. You need to choose a joint coach for your care journey. Your joint coach plays an important role in your recovery, so it is best to select a spouse, family member, or close friend. They will need to be present on the day you are discharged from the hospital so they can be educated on various aspects of your recovery, including exercises, positioning, and pain management. Your coach will need to be available to assist you around the clock for up to 1 week after you are discharged from the hospital. If there will not be someone to take care of you once you are discharged, your surgery may be moved to another day until someone will be available to assist you. Check in with your primary care doctors and any specialists such as your heart or lung doctor. In some cases, your primary care or specialty doctor may need to evaluate you before surgery. Schedule an appointment with your dentist before surgery to make sure your teeth and gums are in their best health. Healthy teeth will lower the chances of infection after surgery. If you need to have any dental work done before surgery, you must notify your surgeon's office as soon as possible. After your surgery, you need to wait at least 6 months before having a routine or elective dental work, such as teeth cleaning. Preventative antibiotics are recommended for at least the first 2 years following your joint replacement before any dental appointments. Please notify your surgeon's office of any future dental visits so you can be provided with the appropriate antibiotic. Stop using all nicotine products at least 30 days before surgery. This includes cigarettes, nicotine gum or patches, chewing tobacco, e-cigarettes, and vaping products. Your body will recover faster and you will have a lower risk of infection by not smoking around the time of your surgery. If you have a recent history of nicotine use, your surgeon will order a nicotine test. If the results of that test come back positive, surgery will likely be canceled or postponed. Please contact your surgeon's office or consult with your journey guide for smoking cessation resources. In those with diabetes, good blood glucose control is needed. A blood test called a hemoglobin A1C will be performed prior to surgery. In order for you to be able to proceed safely with surgery, your hemoglobin A1C needs to be under 7.5. Uncontrolled diabetes can lead to delayed wound healing and an increased risk of infection. Maintaining a healthy diet and lifestyle is very important to your recovery. Eat well-balanced meals consisting of fresh fruits and vegetables as well as lean proteins. Examples of lean proteins are beans, lentils, and fish. Make sure you are staying well hydrated before and after surgery as well. Please do not consume any alcoholic beverages for 72 hours before surgery. All patients undergoing joint replacement need to be evaluated in the anesthesia workup clinic known as the Center for Preoperative Assessment and Planning, or CPAP. The purpose of this visit is to evaluate you and make sure you are healthy and safe to undergo surgery. A nurse practitioner will review your medical history and current health, medication lists, and will perform any blood work, electrocardiograms, or chest x-rays they feel are necessary in order to clear you for surgery. They may reach out to your primary care or specialty doctors if needed. They will educate you on which medications to hold prior to surgery and which to take the morning of surgery. You will be asked to stop the following medications 7 days before surgery: all oil-soluble vitamins, multivitamins, hormone replacement or birth control, glucosamine chondroitin, dietary supplements. If you are on any blood thinners such as these, there are special considerations. All blood thinning medications must be stopped prior to surgery. Your surgeon's office will work with your prescribing doctor to develop a blood thinner plan that is appropriate for you. These instructions will be clearly explained to you by your surgeon's office. The following are simple ways you can prepare your home before surgery to ensure you have a safe environment in which to recover. Prepare easy-to-eat meals. Move commonly used items in your bedroom, bathroom, and kitchen within arm's reach or waist level. Remove trip hazards such as throw rugs, extension cords, and toys. Tackle household chores before surgery, such as cleaning your home and laundry, or enlist some help for afterwards for yard work, caring for your home, children, or pets. Make sure all stairs inside and outside of your home have a sturdy railing. Make sure all areas you walk in are well lit. Change burnt out light bulbs, and if needed, add extra light to see. Have a chair with armrests that allow you to easily get up from a sitting position and that is sturdy and not too low. If you are undergoing a hip replacement, you might be instructed by your surgeon's office to obtain certain items that will allow you to be independent with your new joint at home. These items should be purchased or borrowed prior to surgery. To minimize the chance of infection after surgery, there are special procedures done before surgery to avoid infection. One of them is washing with special soap to control or eliminate unique bacteria on the skin. This is also known as decolonization therapy. You will be given a surgical soap or scrub. You will use this each night for 5 nights before surgery, as well as the morning of surgery. To prevent infection, don't let your pets sleep in the same bed with you, starting from the night before surgery and until after your incision is healed. Use a special prescription ointment twice a day for 5 days. Using a clean finger or Q-tip, apply a pea-sized amount of ointment to the inner rim of the nose to create a barrier at the entrance of your nose. Be more aware of hand washing, changing clothes, and pajamas daily. It is also recommended that you change your sheets when you start the decolonization therapy and again before you come home from the hospital. Your nurse will call you within 1 week before surgery to provide instructions on how to prepare for surgery. They will discuss hospital arrival time, eating and drinking instructions, directions for where to check in the morning of surgery, and additional important information. For your stay in the hospital, remember to pack appropriately, but lightly. You should bring 1 set of loose-fitting clothing for when you are discharged. Comfortable, non-skid shoes and socks, such as sneakers, are recommended. Please do not bring flip-flops, sandals, or Crocs. If you have dentures, glasses, or hearing aids, bring those as well. If you use a CPAP machine when you sleep, bring this device with you on the day of surgery. Do not bring valuables such as jewelry, watches, and money with you to the hospital. Do not eat any food after midnight, and please follow any instructions provided to you by your surgeon's office regarding drinking clear liquids before your arrival. Building your muscles now will better prepare you for the activities and exercises you will be expected to do after your joint replacement. Please refer back to the exercise handouts and video links that your nurse gave you at your pre-surgical office visit. To learn more about what to expect during your surgery and hospital stay, please watch the next video of this education series.